As a part of a series where we want to introduce our networking of collaborators, Dr. Ahmed and me have come here to Bulgaria to spend a beautiful day with our dear colleague Dr. Rumen, where we have approached and we have solved a vertical augmentation regeneration using UBGEN CAD mesh. Dr. Rumen, thank you very much about hosting us today. It's been a pleasure sharing the day with you, accomplishing that difficult case. First question I would like to ask you, how has it been your sensations after today and the usage of this CAD mesh by UBGEN?
First of all, I'm very happy to have you here, guys. For me, using the UBGEN 3D printed mesh from titanium, it was a bit challenging, but in the same way, I was very satisfied by the very predictability of the mesh and the way it fits in the bone, and the way it can be fixed, and how it perfectly fits with the soft tissue and the hard tissues. It was easy to manage, and it went very well. So in this case, we'll have a very good bone augmentation outcome for future implant prosthetics.
We're completely sure about it.
Dr. Raman, first of all, let me thank you for the great time we shared today during the surgery. And let me ask you about the high technology we have now and the innovation. How do you think it affects the success rate of the GBR surgeries?
Having the new technologies, especially CAD/CAM and 3D scanning technologies in dental surgery or oral surgery, can have a very good successful rate because of the chance to design everything before the surgery, having good CBCT scans, and of course oral scans. When we merge them, we have a exact same case but in the computer, so we can easily manage, design, redesign, think in every aspect of our future failure, or where we can be more successful, so we clean all the mistakes we can do in the surgery. So by having this before doing the job is, I think, is the greatest part of nowadays technologies, because by this, the predictability of the outcome, it will be very easy.
But without ignoring, of course, the patient and material selection.
There's not just one approach. That's why we have many products. That's why we have technology and our expertise and experience and the knowledge as well. So we have to be very prepared for every patient as a new one, as a unique one.
Talking about this, Rumen, do you agree with me the digital world is quite tentative? Why? Because everything seems to be much more easier. When we're talking about vertical augmentations, till now, we were basing the success of the treatment basically on the skills of the surgeon. Now, everything presumes to be much more easier, but we cannot subestimate our skills as a surgeon. So don't you think that it's a bit risky to make things, at least on the marketing perspective, so easy for dentists to understand them, so easy where at the end they still being linked to certain kind of skill? What would be your recommendation to these kind of new dentists that are amazed by the easiness, promoted by many implant brands, or in this case material brands? Maybe they're gonna jump into kind of scenario that could be much more complex than what they presume from far distance. What would it be your suggestion for this kind of young doctors?
The dentistry, and especially oral surgery, is targeting for to sell a very easy product, very easy to manage, even for complex cases. Everything they promote is the easy way. There's no a such way.
Every way is hard way. I mean, hard working, studying, and knowledge. This is, of course, every surgeon and dentist should know it. That the hard part, the surgery and the job, first come the theory and the knowledge, then the skills. But skills are built up very like
Step by step.
building skills. And by building skills, this is another topic I want to catch, is nowadays fashion of regenerating or covering implants only with soft tissue. I absolutely respect that, but there's no soft tissue supporting by soft tissue, so we need to have a hard tissue, and this is where the hard part is coming.
Sure. And talking about high standards in terms of planning our cases, choosing our patient, here comes, like in real life, the eternal question. What's first, the egg or the chicken? What I mean with this question? All right, I know that I want to place an implant, but what is our purpose? Place the tooth. So what's your opinion about this new trending of avoiding regeneration and placing tilted implants and rebalancing by abutments? Wouldn't it be much more easier, in your opinion, and much more high standard quality? In case I need to place an implant here and I have no bone, first of all, I'm going to approach the bone to ensure the quality and the support of the soft tissue. And then later on, in a second stage, I will make the approach for the implant.
I want to say a phrase which I know from a big doctor, Dr. Fromovich. He once said, respect the bone, respect the tissue. So all we're talking about is anatomy. If you have a proper anatomy, you have a proper prosthetics, and you will give a lifelong for these prosthetics. So if you build and if you get close to the first anatomy from the beginning and stay close to the nature, you have better implants, you have better prosthetics, you have better outcome, and the patient will be happy for a long period. But if we make it easy, if we make it fast, if we make it cheap, everyone knows what is
Already announced failure. Yeah. Already announced failure.
for me.
Sure.
For me.
From your point of view, what is the best ratio we can have for mixing allograft with xenograft to reach the best result in the GBR surgeries?
I have tried a lot of ratios. Anyway, I find that when the autogenous bone have a bigger ratio than a xenograft, it's always better when you have more autograft. But with the xeno, it gives you this scaffold and this thickness to the graft, which only autogenous bone can give you. And also the quality of the bone, because I had many cases reopened after the augmentation, and I see the quality of the bone even on the 4th and the 6th months. I have cases when I load implants on the 4th month, and they're just perfect. Even I didn't expect that, but by the case, we should choose how much to have the autogenous mixed with xeno, but always for the autogenous is more. For small cases like periodontal defects or any small pockets or some small defects around implants, I use only xeno and fast resorbable membrane. I have good predictable outcomes because we have a good blood clot. This is we have like a 2O or 3O defect, which is easily managed by the recovering of the body, so and the wound. So there I do only xeno.
Cases with large defect, mixing autogenous bone with xenograft can affect the healing time and also make the result much better.
Yeah, of course it can affect the healing time. It's when you mix it with autogenous bone, it's faster, and you can trust the graft is going to resorb and reform faster than using only xeno, or more xeno than auto. But I see with using with membranes. First, of course, for large defects we use long time resorbable membranes. Of course, we need more time for this big defect to regenerate, and always use pins because we have to fixate the membrane, and you know there's no bone growth when you have a moving bone. So
That's why we are using slow resorbable membrane
yeah, slow
4
resorbable.
months to 6 months
Yes.
to fix the graft, and it gives a chance for osteoplastic activity to make new bone and to have better result.
Yeah, yeah.
Oh, and also talking about the osteoblastic and clastic activity, there's another key point in my opinion. We all know there's a vast offer in the market. So then sometimes we get some doubts about which xenograft to be chosen because we have a vast offer. So Rumen, you as a collaborator of UBGEN, as a lawyer, doctor of UBGEN, which would be the points that would you remark on UBGEN xenograft, yeah, to make in an easy way understand our colleagues why they should stop and start thinking about using UBGEN instead of any other well-known till now brand?
I smile because first time I used UBGEN, first of all, it was introduced to me like the low temperature lyophilized bone, because we all know from before all of the other bones in the market are sold and introduced like high temperature remove of the biological tissue. But this was different, and for me, in words, doesn't mean nothing. Like, okay, I cannot imagine what happens with this bone when you remove the biological cells with low temperature. So what I did, it was just like in my surgical flow. When I start working, I put the graft in the plate, I mix it with saline, and I was shocked by the sound of this bone, what makes in the plate.
So just even before using on the patient,
Yeah,
you were
yeah, yeah.
realizing about the difference.
Yeah, it was like you're touching something that is gonna live where you put it. It's not, you're not scratching any plate or some particles that are so hard.
So you even get this crystal sound.
Yes,
this
I
scratchy
couldn't
sound.
imagine when I used other grafts. I couldn't imagine how this gonna work in the surgical site I'm working at. But this graft, when I put it in the plate, this satisfied me a lot. So from this time I got, you know, in love with UBGEN, and especially bone product, and membranes are other part because they're so easy to manage, but stay to the bone. You can feel it's vital, and it has a vital sign. It's easy to manage. Only with a saline and a little bit of blood, it can stick, and it can be easily managed to the defect. So,
But before leaving this point, and I want to discuss this with both of you as a great surgeons, do you agree with me that in big defect, large defect, and if we will use autogenous bone mixed with xenograft, we can maximize the osteoplastic activity and the result by using hyaluronic acid like Actibone, okay, which make our graft sticky, like sticky bone, like dough. So we can, first of all, we will have the anti-inflammatory effect of hyaluronic acid, antibacterial effect, and also we will...
And raising hydrophilosity. So that means a wet magnet to life, which in this case is blood. Yeah. So it's like a kind of booster, yeah, for the osteoblastic activity, at least in the first phase. What has been your experience with the Actibone? Because in my opinion, it's an amazing, and this is something which we can proudly say out that it's not that easy to find in our competitors. This complement, yeah, for our predictable regenerations, yeah. So what's your opinion about this Actibone added value?
Thank you for the question. Yeah, this is very good aspect for the bone regeneration surgeries. Many times I was asking myself and my nurse, isn't there a way not to prepare PRP, PRF products from the patient? Because needles, we need to centrifuge, we need to prepare, we need another equipment.
Another invasion.
Yeah. I was asking myself, is there a way? So yeah, there is a way. And especially in cases with a sinus lift, lateral approach, or lateral augmentation, I find it very good to enhance mixing with bone hyaluronic acid to be a good friend for the good outcome of the augmentation.
Sure, it's amazing.
You secure the graft. You
Absolutely,
be
this is the
more
first
sure, especially in the large defect cases.
Especially there, like sinus lifts, it's not a small defect case, it's a large defect case. And as I said, in large defects with vertical and horizontal augmentation, it will be very helpful as a friend.
Rumen, we know we are going around making this series with many collaborators. So we deal with young doctors, with much more experienced doctors, and ironically, not for young doctors because they are set generation, they're well into the technology, but for all doctors, they're a big scared and skeptical about starting a process there. We have to be waiting for a file to approve and then sending it back to the design center. How would you encourage them, this kind of experience, let's say more mature professionals, to remove from their head any kind of scaredness to this? Because at the end, the procedure, we all know, is quite easy and simple, quite smooth, sending the file. So what would it be your recommendation to these experienced doctors to calm down about this digital skepticism, about them being able to handle the files?
First of all, for me, this will put in their mind and slow them down about the outcome of the case when they slow down the whole process and the whole surgical steps they make. It will slow down the process of making the plan. So, and they will have another opinion from the technicians and the designers of the mesh, for example, and they will change their perspective.
Sure.
And it's an easy way. It's email to email job. It's nothing too hard and it's nothing too complicated. So
and at the end, it's quite visual now. While we're talking, the viewers at the same time are watching on the share screen. Yeah, send images about a project, exactly the same way we send to you. So it's quite practical because you will have these 3D objects. You can navigate it. You can check it your own, the fitting of the project, and you just have to approve it by saying yes. You don't have to do anything.
Yeah, I was very surprised how the questions are exact. There are a few, like 5 questions. You write down your prescriptions, what you want to gain from that product. It be a little feedback with the first design. If you want to change something, okay, there are like 2 steps to change it. The communication is fast and it's good, and you have your product in your hands with a 3D printed jaw and defect you want to reconstruct. You can easily like try it out of the mouth and handle it, and you feel comfortable just like before the surgery, you already know what you're doing. So this as a helping tool is perfect for me. It's so easy.
Sure, and on top of that, we've just given a paintbrush about one of another star product, which are our pericardial membranes. This case, this kind of big regulations will force us to use the slowest option one, where we have the security of keep maintaining the protection up to 8 months. And also, can you share with us, because I'm completely in love with these kind of membranes, the texture, how you can pull them, how you can feel exactly the same way that you said before with the bone, how you can feel the quality even before placing. Can you share with us your experience with the membranes? Because I'm fully in love with them.
Me too. I'm fully in love with membranes. 2 reasons. This is the product the UBGEN have. We can now it's like four thickness sizes, like from 0.2 to 1 millimeter thickness. We have different square millimeter sizes. So the choice you have from the first, you're a winner. Second is the elasticity of the membrane.
It's amazing.
It's amazing, and when it hydrates, it fits to the graft very nice, in a very nice way. No scratches, no nothing. And even if you need to pin it a bit further, you can take it with the pin and fix it wherever you want. It can stretch like I don't know, but it's my feeling. It's about 0.5 centimeter. It can stretch and no damage to the
No
membrane.
fishes, no break membrane.
Yes.
So let me ask you a common question. From your experience, why you recommend precardial membrane over the traditional collagen membrane?
Well, I prefer many reasons. First, I've always slow, and we have slow and fast resorbable membranes, and the periods are just exact when what they say. Other things is microporosity, and of course, I said before, the elasticity of the membrane, and you can trust it. It tears. You have to be very hard on it to tear. I think it's impossible to tear. You have to be very hard on it. And the inflammation part, of course, it's very important for the wound healing. So I think all these 4 things are enough to be the collagen. And the management of the pericardium is way better than the collagen. The collagen just sleepy, not fitting very well. Like I was having headache with them.
Okay, yeah, understood.
So, as we said at the beginning, Rumen is part of our networking of collaborators that for sure is going to be offering clinical residencies where you can spend a day with him and enjoy with him and start making your first step in this kind of high skill kind of regenerations. So now it's time to give a chance to Rumen to share with us the reason why we should start really deeply thinking about sharing one day with Rumen. Rumen, how would you excite people like us to be happy at the end of the day on spending with you one day and encourage them themselves, on making one step further in this fascination world of regeneration in our field?
Thank you. So welcome to Bulgaria. It's a beautiful country in the Balkans. You'll see a good nature. With this nature, you can feel and taste a good kitchen, of course, traditional one. You can feel the Balkan style, like in the air with the music and the whole hospitality we share. I have a good team behind me. And I always be very happy to share my experience, because I had people in my past who shared their experience, and I see when you're open, like all the love you give is the love you take. So I'm happy to give love to you guys, and I'll be happy to share some experience, make new friends, and you're very, very welcome to come as my guest.
So as you can see, we already have a plan. We have good landscapes, we have good trekking chairs, we have superfood, and the most important, as Rumen said, we have good people that will be close to you, empathizing with you. It doesn't matter the state of the evolution on your path on this fascinating world.
Thank you, Roman, for your time, for your hospitality, and for the great time we shared today during this surgery. It was a great job. See you soon in Italy.
See you guys.
See you soon.